More than 60 million people experience heartburn at least once a month. That's according to the American Gastroenterological Association. Now, here are the symptoms. Burning in the chest. It can occur just after eating and last a few minutes or a few hours. Chest pain, especially after eating. Bending over or lying down. Now, a burning in the throat with a sour, salty, or acidic tasting fluid at the back of the throat. Trouble swallowing. A feeling of food stuck in your chest or throat. Joining me to talk about getting rid of heartburn is Dr. Jeffrey Braden, a gastroenterologist from Aria Health. Dr. Braden, so nice to see you. Welcome.
Nice to see you.
Welcome.
Thank you.
Let's get down to the basics. A lot of people have it. What causes the heartburn?
Well, the cause of heartburn is a weakness in a muscle called the lower esophageal sphincter at the junction of the esophagus and stomach. And that muscle becomes weak, and then stomach acid and bile in some patients can reflux back up into the esophagus, causing chemical injury. It's an actual chemical burn from hydrochloric acid produced by the stomach and sometimes bile reflux that also causes a chemical burn or damage to the lining of the esophagus.
When do you know that it's not something more serious, or how should you know? Checkups? When do you know this?
Well, that's an interesting question, very good question. I would say that patients that have heartburn 2 times per week that requires some type of medication, either over-the-counter antacids or one of the over-the-counter medicines like Pepcid AC or Tagamet HB, should consult a physician. Because if there's just, even sometimes when there's moderate symptoms, it can indicate a more severe degree of damage to the esophagus from the acid burn.
If we don't have the medications, the over-the-counter medications, what can someone do at home if something like this occurs? I mean, there you are at home by yourself with no one around. What should you do?
Well, hopefully you have some Maalox, Tums, or Rolaids at home. If not, you could take a couple of glasses, glasses of milk. Milk is a transient buffer for acid, so milk will give you some. Milk will give you some temporary relief, although there's some rebound acid hypersecretion after that. And in a worst-case scenario, you could take some sodium bicarbonate, mix it up in a glass, and swallow it for immediate, instant relief.
Back in the day, Mom used to say, not necessarily to me, but I think my sister may have had it, but some ginger ale or something like that. Does that really do anything, or is that just a myth?
Well, it's not a myth, because if swallowing anything, you're going to strip the acid that's attached to the lining of the esophagus and push it back into the stomach. So even swallowing some water might give you some relief. But it would be better to drink something that has some acid neutralizing properties.
When should you see a doctor?
Well, I would say that if you're having daily symptoms of heartburn, and particularly if you need to take some type of over-the-counter medication on a daily basis, you should consult your doctor. It's estimated that 18 million Americans have heartburn at least twice a week, where they require taking some type of over-the-counter therapy, either antacids or one of the topical medicines you can buy in the drugstore. Certainly that might be an indication for seeing a doctor, but daily heartburn where you need to take medications over-the-counter is a definite indication to consult with your physician.
Very helpful information. Doctor, thank you. Dr. Braden, thanks so much for your information. For more on heartburn or any health topic, check out ariahealth.org, or you can call Aria's call center at 877-808-ARIA, Aria. And we'll have all this on our website, cbs3.com/talkphilly. Do your heart some good. We'll be right back.